Most people who have an addiction have no idea what's really wrong with them. I worked for 40 years with people, mostly with opioid use disorder, and I found that to be true for almost all of the patients. It was certainly true when I went into rehab myself. I had an overdose in October of 1984, and I had to go to rehab in order to keep my medical license. And I know I didn't have any idea what addiction really was, even though I'd been through med school. I was already a doctor. And I had no idea what it had done to my brain and how I even got in that problem in the first place. A patient that I treated will sort of illustrate. He was a guy about 29 years old, came in from West Virginia. He'd grown up in a pretty nice family and he'd been an athlete in high school. And we heard the story so many times. He got injured and the doctor put him on oxycodone and then OxyContin. And he just ended up loving the way that made him feel. And before you knew it, he couldn't stop. And by the time he came to us, he was snorting OxyContin about 80 milligrams, about 3 or 4 times a day. And he'd already been to rehab about 3 times, where his parents were reasonably wealthy. I think they owned a car dealership. And he'd been through a lot of classes, and it had never really worked. He'd never lasted more than a few weeks after getting out of an inpatient rehab. And so he came to us because he was about to lose everything. He was married and his wife was about to leave him with the kids. And after getting his history, it was clear he just felt so horrible about himself. He just felt like he was such a loser. And I asked him, "So what's actually wrong with you? Do you know?" And he sort of gave me this blank stare, like he just thought he was a screw up, that he was just hopeless. And I said, "Wow, you really don't know how you got in this mess and what's actually wrong with you, do you?" And I said, "How it's going to be really difficult to get out of this if you don't know what's actually wrong." I told him that what's actually happened is that you were born with a brain that was vulnerable to addiction, almost always because of genetics. And that once you were exposed to those drugs, they started making changes in your brain that led to a fairly predictable path that started changing things and injuring things in your brain. So that here you are 15 years later, and you're stuck in this disease of addiction. But the good news is that once you understand what's happened, it's fairly easy to, not that complicated, to figure out what are the steps necessary to let your brain heal and go back to normal so that you can achieve complete freedom.